हाय दोस्तों, स्वागत है आपका अपने इस यूट्यूब चैनल पर वन एंड ओनली फार्मेसी। सो फ्रेंड्स, आज हम कवर करने जा रहे हैं डी फार्मेसी सेकेंड ईयर सब्जेक्ट फार्माकोलॉजी का चैप्टर सेंट्रली एक्टिंग मसल रिलैक्सेंट्स एंड एंटी पार्किंसनिज्म ड्रग। सो फ्रेंड्स, आई रिक्वेस्ट यू वॉच दिस फुल वीडियो कंप्लीट। तो चलिए स्टार्ट करते हैं इसके डेफिनेशन से। डेफिनेशन ऑफ मसल रिलैक्सेंट: the agents which reduce the rigidity of muscles without affecting consciousness and other normal voluntary movements of the body are called as muscle relaxants. These are the very simple definitions of muscle relaxant. Examples of muscle relaxant: these are chlorhexidine, methicillin, phenobarbital, etc. Next point: uses of muscle relaxant. What is the uses of muscle relaxant? Which are as follows. These drugs are used during the operative procedures by a surgeon for achieving satisfactory muscle relaxation, in the treatment of various spastic disorders, in the treatment of tetanus infection. These are the some uses of muscle relaxant. Next point: classification of muscle relaxant, which are classified into main two types. First one, peripherally acting muscle relaxants, and second, central acting muscle relaxants. In peripherally, examples: tobicuracin, tobicurarin, tobicurarin, second, succinylcholine. Second main types, centrally acting muscle relaxants. First one, barbiturates. Example of barbiturates is phenobarbital. Second, glycerol ethers. Example of glycerol ethers is methicillin. C. Benzodiazepines. Example of benzodiazepines is diazepam, etc. These are the simple classification of muscle relaxant. Next point, Parkinsonism. What is Parkinsonism? It is a chronic neurological disorder characterized by akinesia, tremors at rest, and rigidity of muscles. It is disorder related to dopamine. The extrapyramidal system, means EPS system, controls the body movements by balancing the cholinergic stimulatory and dopaminergic inhibitory effect. In this disease, there is progressive loss of dopamine, hence the balancing controls of EPS gets lost. In this disorder, certain abnormalities in muscle movement takes place. In addition, the person gets suffered from salivation and mood changes. And how to control Parkinsonism? Which use anti-Parkinsonism drugs. What is anti-Parkinsonism? The drugs used in the treatment of Parkinsonism are known as anti-Parkinsonism. They are used to restore the balance between dopamine and cholinergic. Example of anti-Parkinsonism: methicillin, amantadine, levodopa, etc. Classification of anti-Parkinsonism drug, which are divided into three types. First one, drug increasing level of dopamine, means some drugs increasing level of dopamine and cure Parkinsonism. Example of drug increasing level of dopamine is levodopa, bromocriptine, etc. Second subtypes, drug decreasing cholinergic activity. Example, benzotropine. And drug decreasing salivation. Example is atropine, diphenhydramine. These are the simple three classes of anti-Parkinsonism drug. Thank you guys. These are the simple chapters of pharmacology today I cover. So friends, if you have new on the channel, so please like, share and subscribe to our YouTube channel, one and only pharmacy, for updating all pharmacy related videos. Thank you guys.